Hello everyone, my name is Dr. Yogesh Trivedi. I am Chief and Director of the Trivedi Hospital and Clinical Research Center, Mumbai. Today I am going to talk on a very important topic of today's generation, which is the commonest, which is infertility. Now infertility refers that not being able to get pregnant for more than 12 months or a year in spite of being in unprotected intercourse. So now what are the causes? Causes which is divided into two parts. The one is a male factor, another is a female factor. Now come to the female factors first. Female factor is the commonest one, which is a 40%. Male factor, which is a 30%, and 30% in which the patients have both the factors. Now in female factor, the ovulatory dysfunction, which is the commonest, in which the female has a irregular menses. The cause of the irregular menses, the commonest one is a PCOD, which is a polycystic ovarian syndrome. Now this PCOD can cause difficulty in conceiving. The second factor in the female, which is a tubal factor, in which the tubes are blocked. This also can cause difficulty in conceiving. And the last factor is a uterine factor, in which in uterus there may be some infection, or maybe because of the tuberculosis, which is a common in India. Now come to the male part. If there is a low sperm count, or if there is a low motility, which can causes difficulty in conceiving. Now come to the management part. In management part, first comes is investigations. We do normally a hormonal study, in which on day 2 of menses we do serum FSH, LH and prolactin and AMH level. We also check abdomen and pelvis sonography. We also do the follicular study. In males, there is only one, which is a semen analysis we do for the investigations. Now come to the management. The treatment part, in which if there is any abnormality in any of the hormonal study, then we treat them. We start with the contraceptive pills or with the medication part. Then second is, if there is any abnormality in the semen analysis, then we start with the medication on a male part. If all the reports are normal, then we tell patients for a planned relationships, in which around the ovulatory days they should try for the planned relations. We wait for the 2 to 3 months. If still not conceived, then we go for the Hystero laparoscopy, in which we check for the uterine cavity, we check for the fallopian tubes, and we check for the ovaries. If there is any septum in the uterine cavity, then we can do septal resection and we cure that. If there is any block, then we remove the block from the fallopian tube. If there is any infection, or if there is any other abnormality seen, that can be cured. After that, we wait for 2 to 3 months and we see for the results. Still, if no results, or if still there is no conceive, then we go for the IUI, which is intrauterine insemination. We wait for 2 to 3 cycles. We do IUI for 2 to 3 cycles, and last option, if still not there, then is a IVF or a ICSI. IVF is in vitro fertilization, in which we try to go for the, we have in today's world, we have a so much developed science, then we have very good results in IVF. Now come to the conclusion. Now according to me, the one should have think over the 3 main things. The first thing, in which the female should not think over so much on a career part, because Baby is also important on time. The carrier is with you all the life, but baby should be, you should conceive on time. That is more important. The second thing is the female should not take so much of stress. The stress is very common in today's generation. So you should not take stress, that can cause the hormonal abnormalities. And the last thing, avoid junk food and bad habits. So if there is any problem or if there is any infertility part, then you should not hesitate to visit a gynecologist or an infertility specialist. For more details, you can visit me on a Lybrate. Thank you.